Good afternoon and welcome everyone to today's webinar brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health in partnership with the CDC. Today's webinar is Recognizing Infection Risk, Session 1. What does it mean to recognize risk? A quick refresher. This is the first in a 3-session series on recognizing infection risks. Information will be posted in the chat on how to register for the next upcoming sessions. I'd like to thank you all for joining us, and I'm so excited everyone is here. And I'd like to thank you for the vital role you play in healthcare. Before I introduce myself, I'd like to direct your attention to the chat. There you'll find a link to our pre-session survey. In order to receive your certificate of training, please fill out the survey. It will be closing shortly into the webinar. So take a few minutes now if you haven't done so already. My name is Stephanie Doyle. I'm an infection prevention training liaison for Project Firstline Rhode Island and a community public health nurse coordinator here at the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health. I've been practicing healthcare for over 20 years. I've worked in many different roles, including direct patient care, management, and education. Today, I'm here to present this topic to you and learn about your past experiences and how those experiences have helped you develop your approach to providing care. It goes without saying that the pandemic has impacted us all on many different levels. One important thing that we as healthcare workers have learned from it is that we need to stay vigilant and maintain high standards of care, especially when it comes to infection control. Again, I'm so happy to be here with you today to present to you this 30-minute interactive session. Before we begin, I have a few quick reminders. I'd like to, again, direct your attention to the chat and introduce Abby Anderson. She is our Project Firstline Rhode Island project assistant, and I have the whole team here with me behind the scenes in support of this webinar. And Abby will be posting in the chat throughout the webinar. Now, if you'd like to take a minute, if you could introduce yourselves, tell us where you're coming from, your name and your organization. I'm sure everyone is familiar with the Zoom platform, so everyone is muted at this time. We do have a Q&A box. If you'd like to post your questions there, we can address those at the end of the session. We have the raise hand icon available. If you'd like to speak, we can unmute you. If you just raise your hand. And then the chat is also available to share your experiences and interact with the team. All right, let's begin. So on our agenda for today, we've already done our welcome and introduction. So welcome again, everyone. I will go through some learning objectives for today's class. Of course, we will look at a brief definition of risk recognition. Then we will talk about how healthcare is different. And then I'm going to ask you for your participation in a short activity. And then we'll bring it all together, go over some key takeaways. And then I have some announcements at the end. I'll ask you for your feedback and a brief poll. And then we will go over your questions and hopefully provide you with some answers. So our learning objectives are to understand the concept of risk recognition with a focus on healthcare settings and apply the concept to infection control actions. So we're going to jump right in and with a discussion question. So everybody's familiar with the chat. I see. Thank you for introducing yourselves. I'm glad to meet everyone. So I want you to think about this question. What is risk? How do you define risk? Think about a recent time at home or at work when you saw a risk. How did you know it was a risk? How did you recognize this risk? Maybe there's a puddle of water in the hallway or a loose dog in the neighborhood. How did you intervene and take action to hopefully prevent something bad from happening? Was it a previous experience or was it something that you were taught? So I'd like you to take some time, think about that question, what is risk? And feel free to share in the chat, or you can raise your hand to be unmuted if you'd like to share. I know for me, becoming a mother has opened my eyes to so many different risks, potential causes for harm in my home and in the community. These risks have made me think about different ways to intervene before something bad would happen, like placing a baby monitor or a playpen to provide a safer environment. My daughter is always climbing on things, climbing on chairs, climbing on the couch. So by teaching her how to climb safely, hopefully I've reduced her risk of falling. No injuries yet, so hopefully it'll stay that way. Think about your day-to-day activity during a global pandemic. Did you ever think that you'd be wearing a mask in the grocery store? Or did you ever imagine having to postpone your wedding plans or an event being canceled? How did you adapt your behavior for yourself and your loved ones to potentially minimize risk? Amanda, thank you for sharing. Potential for something to occur that could result in an injury. Absolutely. Any other thoughts? Feel free to share. The forum is open for discussion. And I'll never forget one of my first nursing jobs. The risk manager in the orientation pointed out, if you see something, you own that. That's your responsibility. If you see a risk, you need to intervene if it's going to harm someone or someone else or yourself. So she gave an example of, someone spilling a drink in the hallway and you come across water in the hallway. Are you just going to walk by that and let somebody else potentially fall? Or you have to stay with that spill until somebody comes to clean it up. Danielle, anything that impedes on my ability to achieve my goals, whether it be wellness and health goals or a financial goal? Okay. Right. So now we'll look at a simple definition of risk recognition. Thank you for sharing. Risk recognition is seeing the potential for a problem to happen, but seeing it doesn't mean it has to happen. We have some examples of seeing a potential problem and doing something to stop it from becoming a real problem, and that is important. You recognize risk and you act on it. Now we're going to see a brief clip of those ideas in action.
You deal with risks every day at work. Think about times when you're mopping up a spill, checking a medicine dose, or when you see a wobbly patient about to fall. You see a possible problem that could hurt a patient, and you take action. You can use this same process of recognizing risk when it comes to infection control in healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and take action to stop the spread of germs. So why are we so focused on germs in healthcare? The risk for germs to spread is different than it is at home and in the community. There's a higher chance for germs to spread in healthcare settings than, for example, a grocery store, because it's where patients who are sick come for care. And patients who are already weak or ill are likely to be more vulnerable to infection. Healthcare is also unique because some of the things healthcare workers do as part of giving care can put patients at risk of infection, like starting an IV. Sometimes we are the opportunities for germs to spread. We interact with a lot of people throughout the day. We touch a lot of things and we use many different kinds of equipment. And these are all ways we can spread germs. All of this is why we have to think about infection control in healthcare differently than we think about infection control in the community.
The concepts of recognizing risk when we're at work in healthcare, like seeing the potential for a patient to fall or double checking a medication dose, also apply to infection control. When there is a risk for germs to spread, you do certain things like clean your hands before giving an injection, put on PPE before doing certain tasks, and clean and disinfect high-touch surfaces like door handles and light switches. Thinking a little bit further about the idea of recognizing risk, can you think of times at work when you recognized a risk for germs to spread? Please feel free to share in the chat. Going one step further, what have you done to stop germs from spreading before they cause problems? The work that we do in healthcare presents many opportunities for germs to be spread. We interact with a lot of people, patients, coworkers, families, and others. We touch many different things throughout the day. A lot of equipment is shared. All these factors are why infection control actions in healthcare are so important for keeping opportunities from germ spread becoming a reality. As a healthcare worker, you can recognize common situations and risks and know what to do about them, which means you can protect your patients, yourselves, your colleagues, and others. Using PPE, clean area between students with disinfection. Thank you. Thank you for sharing. Feel free to keep providing some examples in the chat for everyone's to share. When we think about germs spreading in healthcare, it's helpful to remember what makes healthcare a unique setting with unique challenges and risks for infection control. We think about germs and their risks differently in healthcare than in other places, like at home or in the community. Go to the next slide. Why is this? Patients are coming in for care, so there's a higher chance that they already have an infection. Many patients are ill, weak, and vulnerable to infection when they come in for care, so the risk for germs to spread is higher. And sometimes the things we actually do to provide care can put patients at risk for infection, like starting an IV. You're breaking that first layer of protection by breaking the skin. If there are germs on the skin or germs on the needle, inserting the IV can push them into their body, germs into their bodies. Do you guys have any examples of the care that you provide putting someone at risk for infection? Finally, we usually have closer interactions with people through our workday than we do in the community. We interact with many people and touch many different things. We share a lot of things and equipment throughout the day, which are all opportunities for germs to be spread. That is why infection control in healthcare is different than in other places, and why it's all the more important to recognize risks for germs to spread throughout your workday. Separating students who are ill from others. Yep. Hand hygiene routine. Very good. Isolate, mask. Great examples. I really appreciate you sharing. Yep, judicious catheter placement. That's a very good example. Yep. Excellent. Right now we'll talk about where is the risk for germs to spread in healthcare. You guys are giving some great examples. Do not skip steps when prepping an IV site. That's great. That's a great reminder. Now I'm going to ask you guys for your participation again, and I really appreciate all the answers we've been getting in the chat. That's great. We're going to do a little interactive activity here. And we talked about recognizing risk in general and about higher risk for germ spread in healthcare. Now let's work together and discuss some infection control risks. So we're going to show you some slides with a picture of a common scene in healthcare, and we're going to try to identify some potential risks that you see in the slides. You can jot them down for yourself to keep in a journal, or you can share in the chat, or raise your hand to be unmuted if you'd like to share. All right, so here we go. All right, so here's our first scene. Hopefully no one has come across this, but it's a scene that's all too familiar to all of us, I'm sure. Yep, Amanda, jumping right in, that's great. Yep, overflowing sharps container. What about the next person who goes to use that? They're definitely at risk for infection. Overflowing sharp, overflowing waste basket. The sharp looks scary, as it does. Pee in the sharp box, definitely. So all the sharps are accessible, actually. Good eye on that. Yep, messy countertop, definitely. Yep. When's the last time that was disinfected? We don't know. Medication on the counter, absolutely. Yep, great. You guys are doing great on this. There's some cotton balls there. I don't know if those are used. Yeah, there is a biohazard sign behind the faucet there, but what is that for? We don't know. Yep, low on gloves. Is there enough PPE available to care for patients in this scene? Do we have all the right sizes for everyone that might be coming into that area? Yeah, everything on that counter is vulnerable to sprays and splashes from the sink. Yep, shared equipment. Awesome, you guys did a great job on that. Soap isn't labeled. Is that soap? I'm not sure. Is there enough soap? All right, great. Great job. Yeah, everybody did a great job. I think we've identified mostly everything in this photo. So we'll move on to the next. Another scene that probably we're all too familiar with. Someone in a waiting room. Looks sick. Any thoughts on this scene? What do you guys see here as a potential infection risk? Right? Not great cough hygiene there. Pen, yeah. Should be coughing into her elbow. She's coughing right on the pen and the clipboard. Right? Arms of the chair. She gets up, somebody sits down. No disinfection in between. Yeah, her mask could be soiled, could be contaminated. Yeah. That clipboard able to be disinfected. Excellent. You guys are great. Doing a great job here. Is that mask a high enough level to contain what she may have, what she may be ill with? It's not a well-fitting mask. Yep, great. True, that could be a waiting room at a facility. Great, yeah. Okay, excellent job. Yeah, telehealth is a great option. Yeah. For pre-screening, you could bring them right into the exam room without having to contaminate anything in the waiting room. Yeah. Great job. Definitely. All right, moving on to the last scene. Looks like another waiting area. Take a few minutes, take a look at this scene. Got two individuals there. Now we have a young man who obviously has an open wound. Yep, blood on the chair arm. Blood's dripping. Could be dripping onto the floor, the chair. He's touching it. So if he touches that and then touches the chair, no masks. Yep, exposing the injury to contamination, definitely. They're in a waiting room, so should they have masks on? Bleed on the floor, yep. Body fluids on the shared chair. It's also holding a pen, the other individual, and a clipboard. Even though he may not be sick, the person before him using that could have been sick, putting him at risk. Great. Very good. All right. Thank you so much for your participation. You guys did a great job identifying risk in these scenarios. These are just a few examples of some things you might see. And now we're going to bring everything all together that we spoke about in some reflection. You guys did a great job in recognizing risk. Now, as you reflect on the infection risk that we talked about or identified, think about your next workday. Can you recognize one risk for germs to spread that's part of your daily work? What about that coffee cup at the nurse's station? Or that empty Purell dispenser outside of a patient's room who's on contact precautions? And how about that coworker who wears their mask under their chin? Let's go one step further. When you recognize these risks, what's one thing you can do? One infection control action to help stop germs from spreading. Feel free to journal your thoughts, keep them for yourself, or share with your coworkers. Share in the chat, or if you'd like to speak, feel free to raise your hand to be unmuted. One infection control action to help. Speak up. That's excellent. I like that one. To re-educate. Continue to educate. Absolutely. If you see poor use of PPE, you take action to correct it. Yep, and correct the scenario ASAP. Excellent. Great. Signage. Yep. Definitely. See something, say something. Love that always. Now, in conclusion, I'd like to review a few key takeaways from today's session and ask you to think about how you can build upon this knowledge to help enhance your practice or the practice of others. Risk recognition is seeing the potential for a problem to happen. You see risk every day at home or at work, and you take steps to minimize it. You can help control infections in healthcare by learning to recognize risk for germs to spread and cause infection and not letting that happen. Healthcare is a unique setting. We consider germs differently in healthcare than we do in other places. The work that we do in healthcare presents many opportunities for germs to spread. Everyone, no matter your role, can recognize an infection risk and take action to keep germs from spreading. I want to thank everyone for participating in today's session, and thank you for being here with us for this quick refresher. Before we open up for questions, I will update you on a few things to take note of. There are a few requirements to receive your certificate of training, If you're in the dental field or the EMS profession, your certificate of training can be used for zero point 0.5 hours of continuing education. So the pre-session survey, attending the live webinar, and the post-session survey are requirements for the certificate of training. The post-session survey will be emailed to you, and it will be open for 1 week from 1 week from today. From today for 1 week, excuse me. And the certificate will be emailed to you on February 2nd. Post-training resources will also be emailed to you sometime this afternoon with this PowerPoint. And remember to follow us on social media. Project Firstline Rhode Island is on Twitter, Facebook, Instagram, and LinkedIn. If you haven't done so already, please add your email to the chat to be added to our distribution list for upcoming trainings. In 2 weeks from today, we'll be covering Recognizing Infection Risk Session 2, How Germs Make People Sick. And then on February 27th, we'll be covering Session 3, Recognizing Risk Using Reservoirs, a refresher. A review. And Abby's posted the links in the chat for those 2 upcoming sessions. Here are our references for today's session. And I would like to invite you, before we open up for questions, to answer our brief 3-question poll, and it will help us improve our future trainings and help us better support your learning needs. Great. Thanks so much. Does anyone have any questions? If you think of any questions, feel free to email us. Can't think of any right now. You're welcome, everyone. And I want to thank you all for joining me again. This was great. I'm so happy for your participation. And I hope to see you soon in the coming weeks. You guys take care, and hopefully we'll see you again.